This is our second federal data training call. Last week, we talked about federal hospitalization data and federal testing data. And this week, we have case data and deaths data for you. We just got the federal cases 101 and federal deaths 101 posts up on the COVID Tracking Project blog. So if you want the text version of this training without all the questions and explanations live, you can see it there. And I'm going to kick over to Amanda to set up the call.
I just wanted to let you know how we're going to work this. I am the host of this meeting, but we'll be viewing Rachel Glickhouse's screen. Rachel is one of our editors. All participants will be audio muted throughout the call. And then I'm just going to sort of, cast eyes over the gallery, and I will be video muting people, really, even if they're doing anything a little bit distracting. So just be aware of that. However, we do want to take your questions. So please do put them in the chat. All of your questions will go only to me as the host, but I will be passing those questions on so that we can make sure everybody can address them. We probably won't be able to get to all questions, but we'll give that a shot. And then after the meeting, we absolutely will be sending the recording and sending the link to that. And we do have posts up on the blog that recap a lot of this content.
And we'll send the slides. We'll send you the presentation
and
as well.
And the slides as well. Yep. All right. With that, great. I think we'll begin.
Okay. Hello, I'm Jennifer Clyde. I'm a data quality and data entry shift lead here at the COVID Tracking Project, and I'm going to talk about the federal case data and how to replace our data with it. Next slide. So case data background is that public health departments have been reporting nationally notifiable disease case data to the CDC long before COVID-19. So the pipelines and processes for receiving and processing all this data were already in place. Obviously, the volume of COVID presented its own problems, but it makes the case data a bit less complicated than some other data sets that we've talked about in the past. Case data includes three main metrics: total cases, confirmed cases, and probable cases. The criteria for confirmed and probable case classifications are set by the Council for State and Territorial Epidemiologists, and they set out that a confirmed case is a person who has gotten a positive result from a molecular amplification test, which is commonly referred to as a PCR test. Probable cases have a bit more of a complicated set of criteria, but simplified, it's the person who either has a positive antigen test, has specific symptoms and known exposure to COVID-19, or a death certificate that lists COVID-19 as a cause of death. Total cases, of course, is a combination of all the cases reported by a jurisdiction, confirmed, probable, or unknown. The CDC publishes two main types of data about these metrics: aggregate data and line level data. The aggregate data includes just the total numbers of cases by jurisdiction, as well as totals for confirmed and probable cases, and is updated daily. The line level data is literally a de-identified line for each case with detailed demographic data and is only updated monthly. So for the rest of the call, I'm going to be talking about the aggregate data, as it's the most similar to the state reported or CTP data. The line level data sets are described and linked in the post that's up on the website now. Next slide. You can find this aggregate case data on the CDC's data.cdc.gov website. Here on the website, you can actually filter, sort, and visualize the data without even downloading it, so you can get a preview. You can also query the data online using the Socrata Open Data API. It's also downloadable in a variety of formats, including CSVs and the aforementioned API. And the data is updated twice daily. Next slide. You can also download the same exact data set over on healthdata.gov, which is the open data site managed by the Department of Health and Human Services, or the NCHS. The data set's also used to generate parts of the CDC data tracker and is used in the community profile reports that are put out by the HHS, and that I'll be talking about more in a minute because they have some important notes about the data in them. What exactly is in the data set is 15 data fields, 9 of which are about the case data. The rest are about the deaths data that we'll be talking about next. They're pretty straightforward, pretty much what you'd expect. You get total cases, confirmed, probable, and then you get increased fields for total and probable cases. And obviously they're linked to the jurisdiction and dates. In the data set, each row corresponds to one state for one day going back to January 2020. And here we've also mapped each of the data fields with the CTP API field names. And you can see that you can cover them pretty one-to-one. So once you get into the data, how do the numbers compare? So next slide, you can see that at the top level, CTP and CDC data is matching almost perfectly at the national level. When we made this chart on the 17th, the difference between total cases was less than 1,000. When you look in a little deeper on the next slide, and you could go state or jurisdiction by jurisdiction, that is 40 of them match the state reported totals exactly. In 10 states, the CDC data is one day ahead of state reported data, but if you just offset the state data by a day, it also matches perfectly, which leaves us with 6 jurisdictions with some noticeable differences. They're still quite small. They're within 5% difference, or in American Samoa, literally 4 cases. Of those 6, 3 actually have less than 1% difference. So that's probably just caused by minor differences in reporting, like the CDC gets their data at 9 a.m. and their dashboard gets it at noon. Or possibly, small backfills the state may have done, but the CDC hasn't. And then 2 of those states have their probables reported differently in state and federal data. And then the 6th one is the aforementioned American Samoa, which isn't reporting cases itself, but the CDC currently is. And we actually have outreach to those states, or those jurisdictions. And so hopefully a couple of those differences might get cleared up soon. But even in those states, places with differences, they're very small. And all the details are in the post also. If you go a little bit deeper and look at the confirmed, diverse, and probable case reporting, 34 states and territories report the same combination of total, confirmed, and probable cases in both the state and federal data. So it's a pretty sizable amount that are reporting exactly the same.
And
for the
Jen,
remaining,
can I jump in real quick? Because this is something that I always get confused on, but you've explained it to me. So I just wanted to reiterate. This doesn't necessarily mean matching figures. This means the same metrics that are being reported out. So those are like 2 different ways to evaluate what's going on between these 2 data sets. Thank you.
Yeah, always good to clarify. Yeah, it's just we're just talking about the metrics here, not the numbers. So so the confirmed cases are reported differently in 21 jurisdictions. They're shown in the outer portions of the Venn diagram you can see on the slide, and the probable cases are only reported differently in 6 jurisdictions. So it's, again, even once you drill into the data, it's pretty similar. since we don't have direct access to the reporting between the states and the CDC, we can't know the exact reason that these differences in reporting have occurred. But from our own research and from speaking with state officials, it appears it's a combination of small differences in case definitions, small permissions, things that need updating and may not have been updated, maybe small reporting glitches here and there on either side. But they're all easily fixable with a little additional communication between state and federal governments. And the good news is that the CDC has access to all of this information. And there are, a lot of encouraging signs recently that the federal government is working towards releasing more data and more metadata and working in a more supportive way with states on COVID reporting, et cetera. And to be clear, even when there are these differences, they aren't all bad. In some cases, the CDC data has more information about confirmed and probable cases than the state reported data, like in Kansas, where they only post a total case number, but the CDC has the breakdown. There are some additional nuances in the differences in probable reporting that are covered in the post. So go look there if you are tracking and reporting probable cases and plan to use this data set. There's just a few things you should know about. So what is missing from the data set is data notes that are easily accessible when you're using it. And by data notes, we mean notes that explain anomalies in the data, unexpected decreases or increases. Like when a state starts reporting probable cases, for example, often there's a big dump of however many they'd accumulated but hadn't reported yet. Right now, they do have these data notes. They are just in the community profile reports that I mentioned earlier that are available from the HHS. If you get the Excel files, in the user notes tab, they have high visibility data notes, which are notes about changes the state's jurisdictions have made. So in this example, New Jersey had started reporting probable cases, and on another day, they had an unexpected drop in cases. And so that's noted here, which can be really helpful when you're looking at the data and trying to figure out what is actual day over day changes versus backfills or any other kind of anomalies. And then they also have recent change notes, which is notes that the CDC about changes the CDC has made in their reporting. So if sources have changed or if they've added something, things like that. And it would be wonderful if this information could be in the actual case data set. We would also like to see a clear record of revisions to the data set so you can see when there are backfills, if there have been errors in the data and they go back and change them when they get corrected information, things like that. It would be more clear when the data has been updated, and also enhance the transparency and build trust in the federal data to see when it changes and why and how it compares to when state data changes. Both the data cdc.gov and healthdata.gov have functionality to create and save versions of the data set already and do for other data sets. So we'd love to see that turned on, basically. We're not sure exactly how it works because we don't run those sites, but basically put on for this as well. And then just to summarize on the last slide, the differences we've outlined, we don't think are meaningful blockers using the data set. Right now, it's very solid and, as we showed, compares very closely with the state reported data. It could be enhanced with the aforementioned data notes, especially if they're in a structured format so that they could be analyzed manually or programmatically within the data sets, and increased collaboration between the federal and jurisdictional governments to reconcile some of the reporting differences, especially in the confirmed and probable cases areas. But again, even with those small caveats and slight tweaks. The cases and deaths by state over time data set is an excellent replacement for state reported data or our data. And that's it about cases. There's the rest, the post is up on the blog, and thanks for coming.
Thank you, Jen. Just a reminder, we are going to get to your questions that you are sending in to Amanda, but we are going to do that at the end of the whole thing. So at this time, we are going to kick over to Kwong and Joseph to talk about the deaths data.
All right. Hi, everyone. I'm Joseph Ben Simon. I'm a member of the data quality team here, and we've been looking at deaths for a little while. This portion of the presentation is going to focus on the federal death data that's available. There are two data sets that are available. So in addition to talking about what is in the information itself, we're going to be talking about how they compare and contrast to each other, as well as to our data. So the two sets are CDC's COVID data tracker, which is, again, on the CDC's website. It was what Jennifer was just talking about. We'll get into that more in a minute. There's also the National Center of Health Statistics. They publish a data set that is based on death certificates, and we will get into the details on that shortly. Next slide, please. So just to compare how these data sets match up, you'll see that the COVID tracking projects data and the CDC's data line up pretty well in the COVID data trackers. I should clarify, both the NCHS and the CDC's COVID data tracker are housed within the CDC. So in case anyone is wondering, it's all from the CDC. But the COVID data trackers data matches up closely with CTP's data and makes a good replacement for it in that way. The NCHS data also generally tracks the contours of deaths, but you'll notice it isn't lining up as closely. And so we're going to discuss some of the reasons why. If we could go to the next slide, please. So,
Joseph, we're hearing that it's a little hard to hear you. Maybe speak
boy.
up, lean in just a little bit.
Yes,
right?
sure.
Thanks.
How is this right now on volume? Yes. Okay. So I'm going to talk about the CDC's COVID data tracker first. To access it, you can go to the CDC's website. We have the link here. You can also just put in as a search query COVID data tracker, and you will turn that up. If we could go to the next slide, please. So just to again to reiterate, this is the same data set that Jennifer was talking about regarding cases. The data set is called the United States COVID-19 Cases and Deaths by State over Time. And so within this data set is information from 60 jurisdictions. They are the 50 states, DC, 8 territories, and then New York City, which reports separately from New York State. And just to note here, that is a difference from the COVID tracking project's data, where we do not collect New York City's data separately. So flagging that. So generally, as we saw on the previous slide, the data from the COVID tracking project and the CDC COVID data tracker, they line up quite closely. The CDC gets this information from the jurisdictions which report it to them every day, so it's updated daily. And this matches up very closely with what is on states' dashboards. Obviously, the states are reporting to their dashboards, they're reporting to the CDC. And at the COVID tracking project, we use state dashboards as a source of information. So that all aligns. And in terms of the information that's reported about deaths, it breaks down into total deaths, confirmed deaths, and probable deaths. If we could just go to the next slide, please. So this is the table that we were looking at for the CDC's COVID data tracker dataset. For deaths, there are 6 fields. So there's total death, confirmed death, probable death, new deaths, so updated deaths since last update, and probable new deaths. There's also a field, a plain text field, which specifies whether a state's total field is including confirmed and probable together. If we could go to the next slide, please. So just in the way of a breakdown in terms of what states are reporting what. So currently 33 jurisdictions are reporting both confirmed and probable deaths. There are 3 jurisdictions which are only reporting confirmed deaths, and then there are 24 jurisdictions which report a total number. And our best understanding of it is that they're lumping confirmed and probable deaths together in this number. One thing that's important to note in using this data is that because the data is coming from different states and different states have different definitions for how they define these categories, you can't make direct comparisons between 2 states for what a term means necessarily. To give one example, if someone tests positive for COVID via an antigen test in the state of Michigan and they subsequently pass away, that would be considered a confirmed death from COVID, whereas if that happened in Georgia, that would be considered a probable death. So the exact same sequence of events can happen, and depending on state definitions, will be classified differently. So again, we want to stress that the definitions in this data set aren't standardized, even though on the CDC's website, there is a point at which they say that it is standard data. That's a part which could be improved. We can talk about improvements later. Other information about the deaths, they're submitted by date of report. So meaning states are reporting them as they're happening, and all these figures are subject to revision as states review the data and think about what the proper categorization for everything is in a more sort of set way. This data set is best suited for a sort of a snapshot what's happening now view of the pandemic. It's again, the updates are frequent, the data is frequent. However, it comes at the cost of lack of standardization, which is something that is offered by another data set, which my colleague Kwong can speak to now.
Hi, my name is Kwong. I'm also a data quality contributor at the COVID tracking project. And today I'm going to talk to you about this part of the federal death data, which is the data set that is provided by the National Center of Health Statistics. And so from this GIF here, you can see where you can download this data. So the convenient thing about the data from the NCHS is that they have like a index file or an index page containing all the data folders or data tables that they provide. And the way to download these data tables is very similar to the CDC's COVID data tracker because it's also housed under data.cdc.gov. Next slide, please. So a very different thing that the NCHS provide is that death data is still reported by states, but it's actually aggregated through this process of collecting death certificates. So states usually submit their death certificates to the National Vital Statistics System, which is an agency as a part of NCHS, which is a part of CDC, through this National Vital Cooperative Program. That's usually how states kind of keep up to date with submitting mortality reports. And that's how the CDC kind of does their own kind of mortality reports at the end of the year. So this system has existed way before COVID. So they decided, and obviously due to this this resource, they decided to have a page dedicated to COVID-19. So the NCHS officially counts a death as attributed to COVID-19 when it is listed either as an underlying cause of death, so a part 1 of the death certificate, if you're familiar with death certificates, or contributing to the cause of death, which is usually part 2 of the death certificate. So the data set also experiences revisions, but the nature of the revision here is different because it's usually based upon when states submit their death certificates. And by states, I would say that probably the health statistics department of the state health departments usually submits these types of things, and not necessarily like the COVID, data people, or not the COVID data people, but the task force that they set up. And so there's a different pipeline, and some of them submit daily, some of them submit weekly or monthly. So next slide, please. And so kind of the 2 primary data sets you can access through the NCHS is the provisional COVID-19 death counts by week ending date and state, which is aggregated by state. It is very similar to the data set provided by CTP as well as by the CDC data tracker. And the second data set is provisional death counts in the United States by county. So it's broken down by county level. And usually all of the data sets within the NCHS, with the exception of the first one, the provisional COVID-19 death counts by state, is updated weekly. even though even though the state level data set is updated daily, it's more of an update to where the deaths go, and the data set is still aggregated by week. So all data sets are aggregated by epidemiological week, which is kind of the unit of mortality that the CDC and the NCHS like to use for their mortality reports. And so naturally the NCHS data is very aligned to what you would consider gold standard in epidemiological research. So if you do any type of research and you use data like from CDC Wonder, this is very familiar territory to you. So some caveats when you're using the NCHS data. The NCHS does not require laboratory confirmation to count as a death due to COVID-19. They count deaths are both confirmed as well as clinically due to COVID-19. And so it counts both confirmed and probable cases in the way that this Council of Territorial Epidemiologists like to define it, and kind of the standard way that we define confirmed and probable cases. In the terms of confirmed and probable cases in NCHS communication is kind of a bit confusing, but most of the time they kind of they refer these terms to the way that sometimes physicians are very suspecting that someone might die of COVID-19, so they put probable or presumed COVID-19 as part of their death certificate. And the NCHS actually does not provide a breakdown of death into any of these categories. So there's no neat mapping between COVID-19 case data definition and NCHS case data, death data definitions. Next slide, please. So another thing that people have to kind of concern about is that the NCHS data is actually labeled as provisional because of the delay that we talked about. NCHS really cautions against comparing recent data across state lines because of the differential rate in which states submit their data to the federal government. The NCHS kind of estimates that about 72% of deaths occurring within the past 8 weeks would be submitted and presented on the table. And so take that with a grain of salt in terms of the timeline in which you're doing these comparisons. And usually, at least in epidemiological literature, people often use at least a month back when they're doing these comparisons, but it varies case by case. And the data is actually organized by date of death, while data from the COVID tracking project and the CDC data tracker is usually organized by date of reporting. So any delays here is not necessarily delayed by death lag, the reporting associated death lag, but rather by the lag that would occur when states are submitting these types of death certificates to the federal government. Next slide, please. So when you're comparing it once again with CTP data, you can see that the trend usually matches, which gives a lot of confidence to the data that we provide and also the data that the CDC data tracker provides. Given that the NCHS data set is loosely saying more closer to gold standard research, but the differences between the individual states are vary a lot by jurisdiction. Some states are aligned very closely with the NCHS data, and some states are not, and that really depends upon the way that they submit these types of reports up to the federal government. And you can see in the box here when you see the dip in death, and that's the time period of 1 to 2 weeks where the NCHS estimates that the data is most unstable. So next slide, please. And it's not just about, because the NCHS is kind of associated with this whole enterprise of epidemiological monitoring and its legacy system. They actually provide a lot more data than just COVID-19 associated deaths. They also provide all-cause mortality, so how many people that died of any cause in the United States, as well as estimates of excess deaths. So that's something that had been going on in the news recently. They also provide data broken down by race and ethnicity, age and sex, pre-existing conditions, historical death counts from previous years, as well as deaths due to pneumonia, influenza, and COVID-19, which they consider as part of the kind of the monitoring of COVID-19, because a lot of deaths might be mistakenly coded as pneumonia or influenza. So next slide, please. So this is kind of the summary of what we've talked about in terms of comparing the CDC COVID data tracker and NCHS. We would like to stress that both data sets does not represent the underlying true number of deaths that occurred in the United States, and is both an undercount of the true number of deaths. Many experts have confirmed and talked about this issue. But they provide kind of different avenues and different aspects of the death data in which you can interrogate if you're interested in this issue. The CDC COVID data tracker is usually more up-to-date, more timely, and it's more closely aligned with what states would put up on their state dashboards, whereas the NCHS is slower, a little bit less timely, but ultimately the data's definitions are actually standardized across state lines because the data is aggregated at the most basic unit, which is the death certificate. So next slide, please. So yeah, here's our wish list. Joseph, take it away.
All right. So in thinking about the data sets that we've just presented, there's a lot of information in them, and they're really useful. They're good. We like them, and we've discussed how the CDC's COVID data tracker lines up a little bit more to CTP, how the NCHS has its own uses and its sort of the epidemiological standards on that are more well-founded. I would say that for what we would like to see from the CDC, first, not on the slide, but this being CTP would be just more and better data. There's still more data that we'd love to have reported. Just one example in the CDC COVID trackers data set, there's a category for probable new deaths, and there are several states which have values reported for the new probable deaths, but there's no cumulative figure for those probable deaths. And so, for example, Pennsylvania, New Hampshire, there are a few. We detail these in our posts, so you can take a look at that. But we would just love to have that information if it's available. That would be great, especially because these numbers are people. And so in terms of other things that we would like to have, more documentation would be useful. Right now, there is plenty of documentation on the CDC's website, but it's spread across a few places, both on the main deaths page, on the data set there, but also on the facts page, and then in the community reports that Jennifer was talking about earlier in the call. So in order to make it more user-friendly and just in order to get a clearer sense of what's happening, it would be useful for that data to be gathered in one place. That would be great. We would also like the CDC to note that just the data itself, the terms that states are using to define confirmed deaths and probable deaths, as we mentioned before, that varies from state to state, and really just to underscore the fact that this isn't standardized, and if possible, to provide information on how states are reporting the terms, what definitional criteria do they have. And so those are our thoughts for the COVID data tracker. Kwang?
Yeah, so for the NCHS data, the benefit is that the NCHS actually has a lot of documentation in terms of what the data means and how do they aggregate these data, and then individual notes on the individual data tables. The problem that we have is that it's kind of not centralized and it's not really intuitive as to where you can find things like data definitions. They have a section called technical notes, and they also have an FAQ. And so sometimes it gets confused for people where to find what definition. And then finally, we just want to note that we hope that the federal government, and this represented by the CDC, would hopefully provide an introduction on these two data sets. Like the NCHS data is a little bit regulated to the academic world a little bit, although we feel that that data set is also very useful for people who are non-academics to access. And so we would like for the CDC to communicate about like what situations would each data set be representative, and then how do people kind of interpret the result that you would draw, I guess, from each data set. And so, yeah, that's it for our CDC wish list. And you can access our written resources about cases, deaths, confirmed versus probable deaths, or recovered in our analysis and updates page.
And you obviously can't click those links because that's a shared slide. However, you will be getting the slides in your email if you signed up for this call. Thank you, Joseph and Kwang. That was great. We have a few questions, and if you have any burning questions in your mind, this is your last chance to send them to the CTP All Hands account. Want to start with some kind of high-level things. This is for all the metrics. The question is, and we see this one a lot, CTP posts daily update metrics on Twitter. How do I get those 8 top-level figures? The daily and 7-day average number for test cases, hospitalizations, and deaths? The answer right now is we don't know of a single place that you can go to get those things from the federal government. There are a bunch of places you can go to get those things. We have asked the data folks over at HHS to consider making a simple API so that people can pull those things easily. And before we close our doors on data compilation here at CTP, we will give you an easy list of links, which I won't read out to you now, of where we think the best possibilities for those things are. As you will have seen in today's session, there's usually more than one answer for most of those things. So it's not going to be a simple, here's the dailies, here's the 7-day averages, all with one obvious source. But we'll get you everything we know to try to make that a little bit easier. Looking at cases, I think I can answer these, but I want y'all from CTP to jump in if I miss something, which I probably will, or especially if I get something wrong. The first one is fairly easy. Is there any case data source available by state and county? County level as well as state is available right in the CDC data tracker even. So you're going to find county level data for cases and deaths. The next one is about case and death data broken down by demographics. Probably since that question came in, you've had it at least partly answered, but on the CDC COVID data tracker, there is a demographics area, a tab, and that has national data that's updated every day. If you go into the line level data that's public, you can see some demographic data, including some for race, ethnicity, and also sex and age breakdowns. We would like to see a little bit more of that data opened up to the public. And in next week's sessions, we're going to talk about all of the really gnarly details and what is and isn't public in the line level data and other federal data sources for demographic information. Before I go on, anything, Jen, Kwong, Joseph, you wanted to add to that? Okay, great. Oh, and I think, Amanda, if you could just drop, there's a New York City Health GitHub link in the question doc that Kara sent me. That might be a useful one just to post in the chat for people who want to get into the strangeness with New York City and New York State, because it's a little bit tricky. I wanted to bump down to another one that is kind of an overarching question. Says, what are the, there's a lot of work that goes on behind the scenes to get the top level figures. Is there a process, flow chart, or steps you go through to get to the top level? I mean, there are a lot of things that we do to acquire and check and double check each data point, but our national top line figures are actually just a sum of what we get from the jurisdictions we track, and that's all sourced on the CTP website. There's a data sources page, and you can see, we even have screenshots and everything. You can see sort of exactly where all of the data points come from, but there's not a really complicated process once we have the state and territorial numbers every day. Coming back up, data flags to be aware of for demographic breakdowns. We're going to do a whole session on demographic data next week. So, I mean, there is a lot of stuff. There are a lot of quirks to explain about which things are available where. Do our today panelists have anything to say about that? Or do you just want to hang on for the whole session there next week? I don't see anybody jumping in. I think they're happy.
I'd say that the race people, it would be good to talk about demographics and give them their, the time it deserves.
Perfect. Let's see. Looking through new things. We did have some questions about testing data, and I want to note that last week we did a whole testing data session that included a bunch of sort of where you can find the data, as well as all the things that are currently mysterious about differences between state and federal. If you are someone who really wanted to be in that session last week and missed it, just send us an email and we'll make sure that you get last week's slides and things so that you can also benefit from the hospitalization and testing data walkthroughs. A question about excess deaths, I think that mostly got handled in the toward the end of the deaths section. I think this is largely a question about what the actual COVID-19 death figures are and the best sources for that information, which I think you touched on.
Yeah, I would say that like there's no, so far in my knowledge, there's no like definitive best way to count it. Excess deaths is just the way that people kind of approximate the level under counting, and the CDC does provide, NCHS does provide their own estimates of excess counts, the methodology underlying their excess counts calculations, and they provide the raw data so that you can calculate your own excess counts.
Thank you. Someone says, can you be more specific about the county information? Amanda, could you drop the county tab for the CDC data tracker into the chat? That might be a good place to start. There's a lot of data available by county, so you'll probably want to kick it around a little bit. But if there are particular questions about what's in there, once you take a look, let us know. I think that might be it. Amanda, did I miss anything? Okay, wonderful. Thank you all for coming. I do want to say we have more documentation coming. Next week's session and 101 posts are going to deal with long-term care, that's nursing homes and other long-term care facilities data, and also the demographic data. Additionally, we're going to keep posting things to help our data users sort of make the jump. As you saw in the cases and deaths poster, we tried to do some mapping between sources. We'll pull all those things together in the best way we can find. And we also have hope that we may see movement on some more specific answers for which APIs, for instance, you can use if you want to do just simple tracking with the federal data. There's also some new stuff going on over at what is it, beta.health. Let me find it.
Healthdata.gov.
Healthdata.gov.
It just says beta.
There's more coming there. I don't think we can say exactly what it's going to be because we don't know, but we have seen pretty much every week improvements to either the comprehensiveness or the organization of the data that's available. So I would take a look around there, and I would poke around the COVID data tracker, which has really expanded quite a lot and also has more documentation than it used to just over the last months and weeks. Anything else from our panelists before we wrap up today? All good? Okay, thanks everybody. We will have the slides, the recording, and links to all the web pages for you after this.